Good morning, everyone. First, I'm going to introduce myself. My name is Catherine King. I am a registered nurse at Beth Israel Deaconess Medical Center, where I've been working on a neurology floor for almost 5 years. I am currently in school for my master's and to one day be a family nurse practitioner. Currently, I am in an advanced research class where I have been working on my project stroke prevention as my evidence-based project. As I have just mentioned, I have a lot of experience in neuroscience in stroke patients. I found that over the years, all these patients have similar medical histories such as hypertension, diabetes, hyperlipidemia, as well as being a smoker. Statistically, strokes are the third leading cause to disability in the United States. And that is why I'm here today to present to you my grant proposal on reducing strokes by providing patients who are at high risk for strokes with educational services. Here's some facts about strokes. What is a stroke? Stroke is damage to the brain from an interruption of its blood supply. Some major risk factors associated with strokes are age, high blood pressure, smoking, diabetes, high cholesterol, high salt fat diets, and lack of exercise. Some symptoms of stroke: trouble walking, talking, loss of sensation on face, arm, or legs. Stroke is a diagnosis that requires emergent care. Time is important. Treatments of strokes, there's several different kinds of treatments. There's medications, there's surgeries such as carotid endarterectomy. There's also several therapies such as speech therapy, rehabilitation such as occupational therapy, and physical therapy. As I just mentioned, stroke requires emergent care, but it also requires education. And that's why I'm here to present my grant proposal about educational services on stroke prevention. My next slide will show an example of some symptoms of stroke and why time is so important in stroke. Here's an acronym: FAST: face, arm, speech, and time. This is something that we can be teaching our patients to look for in signs of a stroke. It's very important that if they do have these symptoms, that they call 911 immediately and get the treatment they need. Okay, so who is at risk for having strokes? What are the modified risk factors, as I just mentioned? As a healthcare provider, part of our job is not only to diagnose and treat, but to prevent diseases such as stroke. Our healthcare professionals educating patients appropriately, and is it enough? That's the question I have for you guys today. And that's why I'm here to present my project. So, research problem: the gap in today's literature. Stroke is one of the leading causes of disabilities and mortality worldwide, and there is great variation modification of other risk factors such as hypertension, diabetes, smoking, sensation, poor diet, and physical inactivity. However, inappropriate identification of patients at risk for stroke and the absence or lack of stroke education are the gaps seen in literature today and presents many challenges in today's healthcare system. Patients want to be assured that healthcare professionals provide guidelines and educate them on reducing their risk of having a stroke, while healthcare professionals want to ensure that they are advocating for the appropriate strategies using the best scientific evidence. Improving patient education and encouraging patients to change their lifestyles can have positive effects and outcomes in patients' lifestyles. The objective for my grant proposal. The objective of this paper is stroke prevention. Preventative care is a very important step in managing a patient's overall state of health. Many of stroke risk factors are modifiable. With the appropriate education and training from healthcare professionals, we will make patients more aware and cautious to their lifestyle choices. The aim of this project is filling that gap of knowledge in patients who are at risk for stroke by gathering information to improve preventative strategies. So, in my research, I decided to use the interview tool, and I'll explain that now. So, stroke services need to be configured to increase the implementation of evidence based strategies for secondary stroke prevention. Patients want to be assured that healthcare professionals provide guidelines and educate them on reducing their risk of having a stroke. Important patient education and encouraging patients to change their lifestyles can have positive effects and outcomes in patients' life as a whole. So the purpose of my design was to decrease the stroke from reoccurring by educating patients and applying these interventions during doctor visits at an earlier age and or after their hospitalization from a first stroke or TIA. So we conducted an interview to assess the knowledge regarding personal modifiable risk factors and overall general knowledge of strokes. We interviewed about 500 subjects and only 220 qualified for this study. They were tested and scored between 1 and 20. A score below a 10 continued the study, and a score above a 10 would not continue the study. They were each interviewed for 30 minutes and attended a 3-week course Monday through Friday, 7 to 12 o'clock. Subjects were reassessed 1 year later. So in these interventional educational services, what we provided was educational information regarding stroke risk factors. We personally used our subject's medical history. For example, we had a subject who had high blood pressure and an uncontrolled diabetic diet. We educated this person on how important their diet and exercise is to their life and how it can actually change their medical history, reducing their risk of stroke. We gave them packets and pamphlets about the healthier food choices, and some just simply by going out every once to 3 times a week and just walking instead of driving to the grocery store, it might be a good idea to walk. So simple things like these can actually help patients be more aware of how important it is to actually pay attention to what they're eating and their activity during their daily life. Here's a slide about a 6-point stroke prevention plan that we also provided for these subjects. 1, keep your blood pressure under control. The ideal for healthy adults is 120/80. If you have high blood pressure, work with your doctor to reach your treatment of goal. So, for example, if some patients don't understand what a high blood pressure is, and during these educational services, we educated our patients about the parameters and to it is important to check your blood pressure and schedule doctor appointments more frequently if it is on the higher side. Exercise moderately for at least 150 minutes a week. Eat a nutritious plant-based diet. Keep your cholesterol within normal limits. We went over the normal levels of cholesterol and how important it is for your diet to control your diet regarding your cholesterol, and in such as low fat and low salt diet. Don't consume more than 2 standard alcohol drinks per day. and don't smoke or quit if you do. And of course, this is hard for some people to understand, but after this education, after the educational services we provided, we found that a lot of these subjects were willing to change their lifestyle and to cooperate with the program. A pilot study was also performed during this experiment. The pilot study was conducted of only 5 patients who were excluded from the study sample. A pilot study is done in order for the test to be clarity, feasibility, and applicability of the study tool. The final forms were developed based on the results of the pilot study. So literature tool, so the reason why we kind of chose the tool, like the interview tool and the educational tool, here's 2 articles I chose that provided valid evidence in why educational services are so important. I kind of wrote about their tools they used and how they used it and why, and the conclusion of them. Here's the next picture this is just a picture of an interview questions. Oh, if you click here, you can actually click for the example of the informed consent that I had my subject sign, and then I had them also fill out a survey as well. So in conclusion, the educational program for high-risk people of stroke improved their knowledge about stroke, warning signs and symptoms, risk factors, prevention of complications, and immediate action. The participants gained awareness and a positive attitude towards changing their lifestyle and risk factors for stroke. The literature reviewed throughout this project supports the research question. The literature expresses the experience of stroke victims as well as provides information that outlines the patients that are at risk for stroke and need intervention in the form of preventative care, intervention to limit risk factors, and adjust lifestyles. In conclusion, victims of cerebral vascular accidents or strokes experience trauma and life-altering consequences of this outcome. The after effects take a toll on both patients and their families. Practitioners have the ability to make a difference in the lives and healthy outcomes of patients and families by identifying the potential risk groups and characteristics and screening their patients for them. In this way, they can implement the appropriate teaching tools for their patients. So this is why you should fund my proposal. Think of, for example, my grandmother. And it was unfortunate that she suffered from a stroke. Not only did she suffer, but my whole family suffered. She ended up having to move in with us, and we had to care for her. And just watching her suffer was not a good experience. But that is actually what led me to why I am here today. So think of a loved one you know that has suffered from a stroke, or someone you know that could be at risk. By funding this proposal, could change the lives of those people by living a better life. Education will continue into the inpatient setting for people that experience TIAs or strokes or at risk for strokes. Education can be given and reinforced to prevent the repetition of these events. Evidence shows that these methods are proven to be effective in the effort to reduce these instances. So, as a future healthcare, I'm currently a healthcare professional, but as a future healthcare provider, I plan on going into preventional care settings, and I plan on applying these methods, such as educational services, to my patients, making them more aware of what their lifestyle choices and how their lifestyle choices can affect their future. I plan on starting them off at a younger age. I find that patients come in at like 50 or 60 years old and are having strokes. When we could prepare these patients at a younger age, such as 20s and 30s, and making them more aware of their diet changes and how important physical activity is for the human body. And that is why I feel you should fund my grant proposal, because this could stop people from having strokes and living a longer, healthier, and happier life. And thank you. Have a good day.